My name is Monika Devi, working as a lecturer, Rama College of Nursing, Rama University. Today we will discuss regarding the coronary artery disease. Coronary artery disease is also known as atherosclerotic heart disease. So, atherosclerosis means it is an accumulation of lipid or fatty substance or fibrous tissue in the lining of the arterial wall. So, because of that atherosclerosis, it will make a plaque formation, and due to that plaque formation, it will be narrowing the blood vessels and it will decrease the blood flow to the heart. That is also known as coronary artery disease. Next, we will see the definitions of coronary artery disease. So, coronary artery disease is the narrowing or blockage of the coronary arteries usually caused by atherosclerosis. So, atherosclerosis is nothing but it is a formation of lipid or fatty substance. Due to that, it will form a plaque. Because of that plaque formation, there will be a narrowing or blockage of the coronary artery. So, it will be decrease the blood flow and it will be reduce the blood supply to the heart, and this condition is known as coronary artery disease. So, after the definition, we will see the causes and risk factor. So, causes and risk factor we can see divide into two, that is modifiable risk factor and non-modifiable risk factor. So, modifiable risk factor means we can change according to our habit and lifestyles. This risk factor we can change into good things. So, what are those modifiable risk factor we will see, that is increased cholesterol level. So, increased cholesterol level means if in the body the cholesterol level is more than 200 milligram, then it is dangerous to the body. So, it has a chance to develop the formation of cholesterol, it will be deposited in the blood vessel and it will be form a plaque and it will lead to coronary artery disease. This is the biggest risk factor in the coronary artery disease. And hyperlipidemia. So, increased level of lipid is also more dangerous, and cigarette smoking. So, cigarette smoking, what it happens in cigarette smoking, it will be vasoconstriction will be happen. So, vasoconstriction will be happen, due to that it will be decrease the blood flow to the heart. And stress and behavior pattern. So, stress and behavior pattern means when our emotional is feeling depressed or in the emotional stress, that time our hormones, endocrine hormone will be released and it will affect in the heart. And hypertension also, when the hypertension, the oxygen demand is more and it affects in the coronary artery system. And diabetes mellitus, obesity, physical inactivity, due to lack of the exercise also it has a chance to develop the coronary artery disease. So, these are the modifiable risk factor. And next is non-modifiable risk factor. Non-modifiable risk factor means we can't change that risk factor, it has to be maybe inborn or it has to be fixed, that is non-modifiable risk factor. So, family history of the coronary artery disease, this one we can't modify. So, next is increasing age. Due to the increasing of the age, there is a chance of increasing the coronary artery disease. And gender, in gender it is more occur in the male. So, while comparing to the female, it is more chance to occur in the male. And in the race, also it is more chance to occur in those who are in Australia and Africa. These people are more risks of the coronary artery disease. Next, we will see the pathophysiology. So, it comes to the pathophysiology due to the causes and risk factor. Due to the more cholesterol level or due to the more increased level of the lipid, it will accumulations of lipid will take place. So, accumulations of lipids will take place, it leads to narrowing of the lumen and decrease in the blood flow. So, how it will be, lipids will be, this is the blood vessel. So, in the blood vessels, due to the formation of the depositions of cholesterol or lipids in a blood vessels, here will be accumulations will take place and this area will become hardening and thicken the some area or some part of the blood vessels. So, the formations or storing of the lipid and fatty substance, it is known as plaque. Due to this plaque, what? The blood flow will be decreased and narrowing the the level of the or the area of the blood flow is decreased, and it will be decrease the blood flow. So, this is the due to the formation of the plug, there will be decrease in the blood flow due to the narrowing. So, in the plug there are two types plug is there, that is stable plug. So, first we will see the stable plug. So, stable plug is nothing but it is a fixed obstruction. So, fixed obstruction, and here the fibrous cap is also thick. Here fibrous cap is thick and the foam cell also less here. And we will see another vulnerable plug. So, vulnerable plug is more dangerous, and it is so many foam cells will be present and so macrophages. It is due to the extracellular fats. Here extracellular fats will be present, and due to the presence of macrophages. So, vulnerable plug, it is made up of more foam cell with the extracellular fats, and more macrophages also will be present, and it has thin fibrous cap. In the stable plug, it is formed with the thick fibrous cap, and here in the vulnerable plug, it is formed with the thin plug. So, because of that, there will be a lumen is narrowing with be more than 70% also. There is no chance to come for the ischemia, but in case of the vulnerable plug, it is a more dangerous, and it has a chance to become the ischemia also. And in the vulnerable plug, here more foam cells and fibrous cap is also thin, and more macrophages. Because of due to this plug formation, the blood vessel will become narrow and will decrease the blood flow. This is the process of the pathophysiology of the coronary artery disease. So, due to the causes and risk factor, it with accumulations of the lipid. So, if accumulations of lipid means it will form a chance of the plug, whether stable plug or vulnerable plug. Vulnerable plug is more dangerous rather than the stable plug. So, because of due to that plug, what narrowing of the lumen and decrease in the blood flow, and because of that, in that plug what it will be, thrombus also will be formation of thrombus and obstruction in the blood flow, it leads to coronary artery disease. So, main pathophysiology is nothing but due to the deposition of fatty substance or lipid or cholesterol, it will form a plug. Because of that plug, that blood vessels will become narrow, and the plug will become thickened, hardened, and it will become ruptures, and it will become the thrombus formation also. Because of that, in the blood flow there will be obstruction, and it leads to coronary artery disease. Next we will see the clinical manifestation. So, main clinical manifestation is the chest pain, and chest pain it radiates to the jaw or left arm. Because of due to the pain not only in the chest, this pain also will radiate to the jaw, shoulders and arms also. And next is sudden cardiac death and epigastric distress, shortness of breath, palpitation, numbness, nausea, diaphoresis. So, all these are the clinical manifestation. What are those main clinical manifestation is chest pain and shortness of breath and pain radiating to jaw, arm, shoulder. These are the most common clinical manifestations of coronary artery disease. Next is diagnostic evaluation. In diagnostic evaluation, mainly history collection. We have to take proper history from the patients or from the client with the proper manifestations. After that, physical examinations, and after that ECG. ECG is the most important diagnostic evaluation to identify the coronary artery disease. So, we have to identify the changes of the ECG, such as abnormalities in the ST segment, or in the whether in the ST segment elevations or depression, or changes in the T waves or Q forms. We have to identify properly changes in the ECGs. And after that, 2D echograms also it will help, or it will be identified to the which coronary artery is blocked. And another most important here diagnostic evaluation is coronary angiography. So, angiography is nothing but to identify the which coronary artery is blockage. Coronary artery can identify with the help or with the procedures of coronary angiography. And next is routine blood examinations, and after that main important thing is cardiac enzyme test. Mainly have to identify which cardiac enzyme is troponin or myoglobin or CKMB, myoglobin and troponin. These are the cardiac enzymes. We have to identify the cardiac enzymes and routine blood examinations also. Next is management. In the management there will be three sections, that is medical management, surgical management and nursing management. So first we will discuss the medical management. So in the medical management, which drugs are we will see. So first one is angiotensin converting enzyme inhibitor. So what is this help in AC inhibitor means? It helps to prevent the conversion of angiotensin and angiotensin 1 to 2. So it will help to increase the blood flow. So examples are captopril, enalapril, and next second one drug is nitrates. So one example is nitroglycerin. It helps to reduce the chest pain also, and it helps the increase the blood flow also. Next is beta blocker. So examples of the beta blockers are propanolol and metoprolol. So next is calcium channel blocker. So in the calcium channel blocker, one example is amlodipine and diltiazem. Next one is antiplatelet. So antiplatelet example is aspirin. This also help in to increase the blood flow, and it helps the widening the blood vessels also. And next is anticoagulant. Example is heparin. When the formation of the blood clots, this heparins will help to blood flow the easily. And next is cholesterol lowering agent. This is the most important and effective drugs in the coronary artery disease. Already coronary artery disease, we know that is formation of the plaque, and because of that plaque formation, with the help of statin, it will reduce the plaque formation. So examples of the cholesterol lowering agent is statin. These are the medical management. Next is surgical management. First we will see the coronary angioplasty. So coronary angioplasty is a minimal invasive procedure that is to widening the blocked artery. So that already blocked artery we will identify with the help of coronary angioplasty. After that, with the help of a minimal invasive procedure with a stent, it will be widening the area. That blocked artery will be widening. That is coronary angioplasty. Next is coronary artery bypass graft. So coronary artery bypass graft, it is a invasive procedures, and it will a balloon will be passed in the groin area or in the femoral artery. So that balloon will be passed, and after that the coronary blocked artery has to be widened, and it will help to pass the blood flow freely. Next is atherectomy. So atherectomy, it is a removal of the plaque from the blood vessels. So atherosclerotic plaque should be removed from the blood vessels. And next is coronary stent, and next is surgical revascularization of affected area. So these are some terminology that is there, that is embolectomy. So embolectomy is removal of blood clot from the artery. And next is thrombectomy. So thrombectomy is removal of thrombus from the artery. Next is endarterectomy. So endarterectomy is removal of atherosclerotic plaque from the artery. These are some surgical management. So mainly coronary artery bypass graft will do in the severe case, because it is a invasive procedures and it is a high risk. So mainly we will go for coronary angioplasty according to the condition, or according to the which artery is blocked and how many artery is blocked. According to that we will go for the surgery procedure. Next is nursing management. So in the nursing management, main important step is to identify the complications and to provide complete rest to the patients, and give more health education regarding the food, exercise, diet, and to relieve from the emotional stress. So we will see some nursing diagnosis. So mainly nursing diagnosis here is chest pain related to decreased blood flow as evidenced by facial expression. And next one, second point is ineffective tissue perfusion related to decreased cardiac output as evidenced by dyspnea. And fear and anxiety related to treatment modality as evidenced by frequent asking position. These are some nursing diagnoses. So mainly in the nursing intervention, what you have to be intervention means mainly have to see the complications and have to provide bed rest properly, and after that have to take care regarding the health, exercise, diet. These are the main steps in the nursing diagnosis. Next is lifestyle changes. In the lifestyle changes, this is nothing but those who are in the modifiable risk factor that has to be changed. That is modifiable lifestyle changes. So in the lifestyle changes, what you have to modify those risk factors. What are those? You can change the exercise regularly, and after that have to reduce the cholesterol level or have to reduce the lipid level, and after that go for proper diet and have to go for to reduce the stress. So stress and emotional stress behavior, it is one of the most risks in the cardiac condition. So we have to reduce the stress also. So we will summarize after at the part of the discussion, that is already we seen the coronary artery disease is nothing but it is a narrowing or damage in decrease the blood flow in the coronary artery. So due to the atherosclerosis, so atherosclerosis is nothing but it is a formation of the fatty or lipid substance in the fatty lining of the artery, that is coronary artery disease. So causes and risk factor already we seen, pathophysiology also we seen, clinical manifestation, diagnosis, evaluation, management and lifestyle changes. So mainly in the coronary artery disease have to remember is to decrease or narrowing of the coronary artery due to the atherosclerosis. Thank you.